Welcome to this video on head neck rehabilitation. In this video, we're going to be discussing the Cervico-Collic reflex and what you need to do as a basic exercise to help retrain your brain. In brief, you've got different systems that are responsible for brain health, balance, equilibrium, vision. So it's going to be your eyes, your inner ear, that is your head, your neck, and also the joints of the rest of the body. As foundation for the brain to be able to work, it's about the quality of the information that it's receiving. And what this is called is proprioception. This first exercise that I'm going to demonstrate in this video is what you can do to make sure that messages from the body and the neck are properly oriented so that your brain knows where its head is in open space. Now, what you're going to need in order to do this exercise, what's called joint position error retraining, is you're going to need a pair of glasses. I recommend them from nerdsolutions.com, N-E-U-R-D solutions.com. There are two options, one which is battery powered and the other which is a rechargeable USB. You simply slide them on, and I'll just demonstrate that what it does is it projects a little laser off of the top like that, and that way it's kind of a proxy about where your head is going to be in open space. What you're also going to need is a target that we can provide you like this, just a simple printout. And in brief, you're going to put it up at the wall so that it is going to be about 3 feet or about 1 meter away from you. And also so that where you are having your head as set neutral is essentially the middle part of the bullseye. Now, the way that this is going to work, you see, when you move your head up and down like this, you should consistently be able to bring it back to within center. And that's going to be anywhere within the green. Yellow is okay, but it's a bit of a problem. But if you're in the red or beyond that, that's not going to be a good thing. So the way this exercise is done is it's done by going down, backward, left and right, and it's done with your eyes closed so that way you cannot see where you're actually bringing your head back to center. When you do the exercise then, and I'll start the video so that you can see a few little examples here. So I'm lining myself about center. My eyes are now closed, so I'm centered here. I look down, I bring my head back to middle. And I'll do a quick pause and let me go back there just a little bit if I can. Nope, it's not going to let me do that. But in brief, you would have seen that when I brought my head up and I opened my eyes, you couldn't see that, but I opened my eyes up when I brought my head back to what I thought was center, and then I made the correction. So I brought things back toward midline. That is the exercise. You are retraining your brain based on the signals about where you think center actually is. So I close my eyes again, open the eyes up, and we're pretty good on the bullseye. So we do it again, same thing as you see. Now we're going backward. Not too bad, but it made a little bit of a correction. So we're pretty good going backward, no issues there. Oh, a little bit of a self-correction right there. So then I do a few more repetitions just to reinforce it. Now what I'm doing is side to side. So as you see, when I turned my head to the left, I was off center the first one, but when I opened my eyes, I could see that. So that was the retrain. As I'm doing the successive repetitions here, I'm more on target, on center. Every person, if there's a disruption of these signals from your body and from your neck going up to your head, it's going to be a little bit different. So for some people, it's going to be worse when you go up or down. Other people, it's left or right. You want to rehabilitate and focus on the areas where you have the weakness. You don't need to do this for 10 minutes a day. Certainly that's useful, but I do recommend lots of it, bare minimum 5 minutes. If you want to do multiple repetitions of that, because at least that's what the research shows us. If you do multiple trained repetitions of doing this exercise, eyes closed, open your eyes up, then make the correction, kind of like this, however it's appropriate, that goes a long way to retrain where your head and your neck are relative to each other. Good luck with that.